Welcome everyone to today's webinar, Making the Contactless Connection. On behalf of Becker's Healthcare and Becker's Dental and DSO Review, thank you so much for joining us today. I'm first going to walk us through just some quick housekeeping details. We will begin today's webinar with a panel presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is also being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. And also, if you at any time don't see your slides moving or have trouble with your audio, try refreshing your browser. Of course, you can submit any technical questions into the Q&A box, and we're here to help. With that, I am pleased to introduce our panel today. We are thrilled to be joined by Mike Peluso, the Chief Technology Officer with Rectangle Health, Lai Ferrell, the Director of Operations, Marketing, and Recruitment for Higginbotham Family Dental, and Cynthia Tyler, the Regional Manager of Operations for Heartland Dental. Last but not least, we're thrilled to be joined by Scott Becker, publisher of Becker's Healthcare, who will serve as our moderator today. Mike, Cynthia, and Lai, thank you for being here. And Scott, I'll turn the floor over to you.
Great. Thank you very much. And thank you for joining us on contactless solutions for the dental industry and dental operations. I'm going to ask each of our panelists to take one moment to introduce themselves. Mike Peluso, I'll start with you. If you don't mind taking one moment to introduce yourself, then Lai and Cynthia, I'll ask you to do the same, and then we'll get into the heart of the webinar. Michael.
Good afternoon, everyone. Mike Peluso, Chief Technology Officer, Rectangle Health.
Thank you.
Lai Ferrell, Director of Operations, Marketing, and Recruitment for Higginbotham Family Dental.
Thank you very much, Lai. Cynthia?
Cynthia Tyler. I am a Regional Manager of Operations for Heartland Dental.
Great. We're thrilled to have each of you join us today. I'll start with sort of a tee-up question. And Mike, I'll start with you and then go to Cynthia and Lai. Mike, when we talk about contactless solutions, how do you define that?
Sure. Thanks, Scott. When we think about contactless solutions, we think about sort of two different methods, a touch-free solution or a touch-free type of contact, and then a virtual type of contact. And with my experience really focused around payments and enabling technology for dental providers, I really think of it as in terms of that Apple Pay transaction that may happen inside of a dental office where now a patient doesn't have to touch anything. They could simply wave their phone over a payment device and they don't have to touch anything. But also the virtual side of contactless, and I think that's probably what we'll focus on the most today is things like online registration. Can a patient fill out their paperwork ahead of time? That's contactless. And then also online payments or digital payment types like text to pay or card on file or recurring payments. Again, all contactless solutions that dental providers could be using.
Thank you very much. And Cynthia, you're with Heartland Dental, major operator of dental operations throughout the country. Take a moment on how you define and look at contactless solutions.
We look at it as patient-focused technology. So anything that the patients can do on their own without having to use a business team member.
Thank you. And similarly, Lai, let me get your thoughts on this from your perspective, what you view as contactless.
Pretty much the same, anything that the patient can do ahead of time before their dental visit, or even after their dental visit, or even during, where they don't have to come in contact with one of our employees, whether it's paperwork, an application for financing, or a payment via text. All that can be done now, mostly because of everything that's kind of going on, instead of having to deal directly with the person at the front desk.
Thank you very, very much. And Lai, let me start with you on the next question. In your experience in dental, how prevalent are the digital-focused, patient-focused interactions today? Has it become, what's the prevalence of that? What are you seeing?
We're seeing more and more that how important it is to make sure that we not only have those things in place for our patients, but it provides a good experience for them. You know, they want it to be convenient and easy and quick. So we've always kind of had some things in place. We've kind of upped our game, obviously, since all this, since we have more people now utilizing these features. Before it was just, it's there if you need it. Now you need to go do this before you come in for everyone's safety. So it's very prevalent, and it's very important to stay ahead of making sure that it's easy and otherwise patients, won't want to do it.
No, and you hit a couple points really well, that you and parties in the industry have had to up their game since COVID-19, where before it used to be sort of an option and not an often used option, and now it's very, very prevalent. And then your point on everything you do has to be so easy for patients to use is so important as well. Cynthia, a couple of your thoughts on the same question. How prevalent is this becoming throughout Heartland, and what are you seeing?
Very prevalent. We are honestly, we've moved quickly into, this patient-facing technology, and patients expect it. I feel like the pandemic really forced us to move forward with it quickly.
Thank you. Thank you very much. And Mike, you see this across an entire industry perspective. What are you seeing in terms of digital-focused, patient-based interactions today? What's sort of your sense of it?
Yeah, it's definitely prevalent, Scott. I don't know if it's pervasive yet, but just like Lai and Cynthia said, it is getting there. The pandemic definitely pushed everyone over the edge, but payment plans have existed in orthodontic for a while, and online payments have existed in dental for a while, and now you're starting to see a lot of text to pay, or you're starting to see a lot of card on file, and you're really starting to see a lot of that online registration, that online paperwork that really eliminates a lot of that back and forth with patients when they're standing in the office. If you can enable that for the patient pre-care, that's really starting to become prevalent. And I think all of it, just like everyone else said, all of it will become sort of widespread in the industry for sure. It's here to stay.
Thank you. And so some of it had predated the pandemic, some not. Cynthia and Lai, let me ask you that question. How much of this do you see in your organizations and what you see from colleagues that you talk to outside your organizations is a reaction to the pandemic versus how much is things that were on their way to begin with anyways? Cynthia, let me ask you that first.
Well, I believe we knew that there were these contactless methods available, and we were slow at rolling them out, just afraid of the change and everything. But the pandemic forced us to move quicker into making the changes.
So let me ask you a question. Like, some people have said we did 10 years of advancement in 6 months because a lot of this stuff would have rolled forward sort of slowly if not for the pandemic. Would you look at it similarly to that, Cynthia, that sort of like just a ton of progress in these things in a relatively short period of time that might not have happened nearly as quickly but for the pandemic?
No, absolutely. I've been surprised at how quickly we moved forward with everything. We knew, we talked about it and knew that there were these options available, but I don't know if it was the bravery or what, but the pandemic made us move quickly into it. And it was like you implement one thing and 10 things come with it. So yes, I think the pandemic forced us to move quickly into the contactless solutions.
Let me ask you a question. Once you implement a couple things along those lines, is it easier to implement more as you start to get familiar and comfortable with it?
It is because it's interesting to me that once you implement something, so for instance, new patient paperwork, instantly you can now do updates on health histories. And so it just makes sense to do that. Now you can do have patients pay online because they've agreed to do the online paperwork. So many things rolled into it quickly.
Thank you. And Lai, some of your thoughts on whether this is happening in a reaction to the pandemic or whether it was coming anyway. Some of your thoughts on that, Lai.
I think some of it was probably coming anyways as, technology grows. But I definitely think how quick it happened is a reaction to the pandemic. For us, when this happened, my main focus was we need to be able to contact our patients and talk to them as much as possible and communicate with them so they know what's going on, because everyone was pretty much clueless as, once the shutdown happened. And the quickest and easiest way to talk to everyone was obviously text. And, we didn't have it where you could text our phone number directly to each office before, and we rolled that out pretty quickly once this all kind of took place. And then once that happened, it was like, well, why don't we go ahead and do text to pay and do appointments through texting? And so it just kind of, like Cynthia said, once you kind of implement one thing, you kind of roll out with a few other things that kind of go with it. So it definitely made us move in that direction quicker because of the pandemic. I don't know, in some places probably would never even went that direction had it not been for this, but I think a lot of people are starting to move that way.
Thank you very, very much. And Mike, I'm going to ask you this question. I'll start with you on this. How do you see practices, and you work with practices and chains throughout the country, DSOs, practices, both independent and part of large DSOs. How do you see people prioritizing a contactless interaction of patient engagement in terms of qualities like safety, security, and simplicity? You're talking about those qualities. Mike, what do you see out there?
Yeah, Scott, it's great question. And it really, the sort of the list that we have displayed is actually backwards. I think it's simplicity, and it's simplicity for the patient. These contactless interactions have to be simple for the patients to use. It can't be a long, drawn-out process for a patient to register. It can't be a long, drawn-out process for the patient to make an online payment. And then that simplicity has to carry over to the office. The users, the office managers, the office staff, it has to be simple for them as well. If it's complex and they can't get new patient paperwork very easily, or they can't send a text to a patient very easily, that's going to make it difficult to adopt and utilize. So simplicity definitely comes first. I think security and safety end up becoming a byproduct of simplicity. The solutions have to be secure, and obviously safety of the overall office is going to increase because we're now utilizing these contactless solutions.
Thank you. And sort of a brilliant take on it. It starts with simplicity, and that was lost a lot of times by technology firms over the years, or software as a service firms, and it really has to start with simplicity, and then it, of course, has to check the buttons of security and make the office safer. I think the perspective on it's really right on. Lai, any of your thoughts on how you prioritize looking at these kinds of contactless interaction tools, and how do you prioritize safety, security, simplicity? How do you sort of look at that?
I think they're all really important. It's hard to say one's more important than the other. I kind of look at all three. It has to be, I deal a lot with the online paperwork, and I deal with a lot of the patients that, get a hold of me and say, your paperwork is not working out, the date's not working, the forms are too long, that kind of thing. And so I'm constantly looking at how can I make the forms a better, easier, better experience for them while they're online filling that out. Because I know that the fact that we can even get them to go online to do that is a task in itself. And then security-wise, we got to make sure all our stuff is safe, and that, information's not going to get leaked, and that patients feel secure about what they're filling out online. And then safety, we got to make sure our patients are safe and that our employees feel safe. And I think, I hope everyone appreciates that by doing a lot of these things that seem like a lot of legwork on the front end, helps them understand that it's going to keep everyone safe in the long run. So I don't know how I prioritize it, honestly. I think they're all ones at this point. They're all very, very important. But the first step is obviously you got to get them to even get there to do it. But kind of like Mike said, it has to be simple and
Thank you very, very much. And Cynthia, the same question. And why what you've really said is, look, all three of these are important. It's got to make safety better for patients and for our employees and our staff. Security, of course, has to be important, and then it's got to be easy to use, too. Cynthia, any comments on this balance of safety, security, simplicity?
I agree with the others. I think if I had to figure out which one to prioritize, I mean, all are equally important. I mean, we can't do, it doesn't matter if it's safe or simple if you don't have the security. I mean, we're dealing with patient information, and so we have to make sure it's secure. And so I know for our company, that was one of the biggest things that I think held us off for so long was how do we make sure everything's secure? So, I mean, all three are important.
Thank you very, very much. And let me ask you this question, and I'll start with why. With contactless solutions, embracing digital tools, can these help from a practice perspective to deliver better care? Is there a correlation with higher or better levels of care? Lai, I'll ask you first, and then Cynthia, go to you on this question. I mean, can you tie this to better care?
Yeah, I can say before, we've had ways for patients to contact us via chat online or texting us directly to the office, but it wasn't really utilized that much. Now that our training with our staff is to really push those contactless ways of messaging us or talking to us versus just coming in the office. We have a lot of rural locations. But now people can feel safe and get better care because they can text us at any time about post-op questions or pain that they're having. They can send pictures directly to the dentist and be like, does this look like I need to come in right away? Or they can get on our website and chat with someone right away no matter what time it is. So having these digital tools that we've kind of always had, but now that we're pushing more in the forefront to our patients, to me feels like a better, higher level of care because they feel more taken care of. They feel, that they're still priority even if they can't come in the office.
Thank you very, very much. So at the end of the day, making it easier for patients to see you, more confidence to see you, more confidence to get their help can really improve and lead to higher levels of care. I think a great perspective. Cynthia, same question. Does embrace this digital technology, digital tools, can it lead to better care?
I think so. I honestly do. I think it's twofold because number one, it puts the patient in the driver's chair. They're in control. They decide when they want to make appointments. They look and see what's available, and so they're in control of it. So I think that's great. But also, it frees up the business team to be able to really wow patients, because they're no longer, covered in phone calls and all of the busy work that they had before, like, verifying appointments, confirming appointments and things. So yeah, the patients get better care because the team has more time to take care of them.
So that's also a great perspective. Not only does it make the patient easier for the patient to interact, it also, in the ideal world, and a lot of times with Rectangle and so forth, it saves staff time and takes them out of grinding tasks and allows them to spend more time on actual clinical time, patient-centered care versus on administrative stuff. So it's a great perspective. Thank you, Cynthia. Mike, talk about overall patient satisfaction. How does patient self-service capabilities, on the patient have more control of how they're doing things, lead to better patient satisfaction, or doesn't it?
Yeah, I think Cynthia put it best. When you put the patient in control, everything else kind of takes care of itself. The dentist obviously can deliver really good care, but when you put the patient in control, the rest of the office can also focus on that patient's satisfaction. And the patient now has the expectation of, well, I'm going to pay when I'm ready to pay. I'm going to set an appointment when I want to pay. These digital contactless solutions, they allow the patients to have more control. And when the patients have more control, they're generally overall more satisfied. They can make a payment on their terms, meaning they don't need to be asked by an office manager to make a payment. They may have been asked for their card on file before they got to the office. So that relieves that whole tension of having to pay when they're at the office. They may not need to leave a copy of their insurance card when they go to the office. They don't have to bring it. They left it before they went to the office. So that these contactless solutions and these virtual solutions, they really free up, and Cynthia said this, they free up the office, they free up the dentist, they free up the billing team to just take better care of the patients, and it becomes an overall better experience.
Thank you. And Mike, it's becoming clearer that so many of these things are so valuable to practices and to both patients and the offices. Let me just ask you this follow-up question from what you're just talking about. How quickly is this stuff being adopted by practices? Because it seems like the case is so clear that it needs to be. What's the pace of penetration? How quickly are these things moving forward?
Yeah, we touched on this early on. I mean, COVID has really put it into high gear. It was a slower adoption pre-COVID, and now the adoption is much faster. The demand is much higher. We've noticed that sort of across the country. The demand for things like text to pay, the demand for things like text conversations, the demand for things like patient registration has really skyrocketed. I think what we're working on, or what we're trying to do, is match adoption to the demand, meaning you can't do all this stuff in one day. You can't say, all right, on January 1st, the entire sort of DSO is going to start doing online registration, text to pay, card on file, online payments. It kind of needs to be taken in a slow, scalable approach. But Scott, the demand is there, and the tools are getting delivered as quickly as possible to meet the patient demand.
Thank you very much. Cynthia and Lai, I'm going to ask you the next question. In a lot of situations over time, whenever new technology was being adapted, you have this mix of staff sort of excited about it and fighting it, and a lot of times fighting it because it was laborious to implement, whether the point of service, point of sale system, whatever it might be. You know, it would seem to add so many headaches to the job before it started to pay benefits. But now with the world and the pandemic and so forth, Cynthia, I'll start with you. Does the office staff, is it easier for them to see the benefits of adopting digital tools today that can hopefully increase efficiency and improve patient satisfaction? Is it easier to get staff on board with this today, Cynthia?
I don't know if it's easier. The learning curve is hard. You know, you've been doing your job the same way for years, and suddenly everything is going to change, and you're going to have these bumps along the way because you're going to run into issues. I think for us, it was just really figuring out, getting everybody on board with how we were going to implement and how we were going to move things forward, and then almost, forcing the team to do it, because, it's easy to stop something and just think it's not going to work. So, yeah, I think they do see the benefits. I just think it's still that learning curve.
It's still a lift and a learning curve. And how challenging was it getting through to the other side where people started to say, okay, this works, it's not so hard, we've got adjusted. I mean, I know like in traditional medical practice, EMRs, took a couple of years for physicians and staff to get to the other side of the stuff. With the pandemic, I take it the curve on this stuff is quicker. But how long did it take, Cynthia, for staff to start to see, okay, I got it, this is okay, we've had to do it, we're doing it, it's going okay?
That's an interesting question, because at the beginning, when we first started implementing things, it seemed like it took a long time. For instance, being able to fill out paperwork online. It took a while to get the team to do that. But once we got through that, things started rolling fast. I mean, for instance, patients being able to schedule their own appointments. Seriously, we implemented that in like 2 weeks, where it took us a lot longer with patients filling out paperwork.
Thank you. And that's sort of the sense, that it takes a while to get over that hump, and then it sort of moves faster as people sort of get used to it, and then the institutional learning becomes quicker. because one person can teach it to the next, and it's not so bogged down. Thank you. Lai, similar question. Where's the office staff at on this? You know, in your office, in terms of getting from point A to point B and seeing the benefits of it?
You know, after we did about a week of training on all the new systems, and some of it, like I said, we already had in place, we just didn't utilize as much. A lot of them see that within a week were, you know, calling me or texting me or emailing me saying, this is so much easier. You know, our patients aren't standing here or waiting 15 minutes, you know, for them to fill out paperwork and then us having to upload it and update their medical history. We already have it all. Like, they saw that it made their day flow easier. They saw that, you know, it made it safer and patients could go back quicker. So it's pretty actually quickly for us. You know, the first week or so of just say, hey, we're doing something new, was obviously anyone's going to react to new changes as, oh gosh, what now? But once they saw how it made their day flow so much easier while they're there and taking care of their patients and their phones not ringing as much and all of that, they not having to call off unscheduled. You could just shoot out text messages to people when you're trying to fill the schedule. Just little things. They were just like, this is so much easier. Why didn't we do it sooner? So for our locations, I feel like our staff has been very receptive to it moving forward.
It's fascinating. They were able to see the benefits pretty quickly. A bit of a learning curve, but not even that bad. And then quickly started to see the benefits. And we could deal with more things by text than by phone calls and phone tag much, much better. Mike, I'm going to start on the next question with you and then come back to Lai on this question. Mm-hmm. How critical is it for dental practices to use these different types of contactless methods, whether it's patient registration, digital payments? I mean, is it ultimately becoming a thing where it's just table stakes in a dental practice, even though a lot of dental practices aren't doing it yet? In any sort of reasonably busy dental practice, you have to get from this stuff. What's your thoughts on how critical it is?
Yeah, I mean, we've already talked about how critical it is for addressing the pandemic and addressing a different patient flow post the pandemic. So I think there's that part, but it's this the other side sort of benefit, or the other bigger benefit, is you're now creating a digital experience that patients are used to. Everybody is now paying for things online. Everybody is now using card on file. Everybody is now, for instance, doing a mortgage. You can fill out the paperwork for a mortgage, which is pretty extensive. You can do it all online. So consumers are used to operating this way. And as the dental offices start to leverage it, it creates that more consumer-like experience. And it makes it so the patient can come into the office, get their dental work done, and leave. And a lot of that pre-work, that pre-paperwork, that pre-filling out the clipboard, or a lot of that post-friction around sort of dealing with payment, dealing with copay, dealing with payment plans, that's all automated and it's handled via technology. So that's where it becomes critical, in that this is how people want to interact. This is how consumers want to do business. And it's no different now in the dental environment, and that's why it's critical.
Thank you. And Lai, a similar question for you. How much does this move towards just being critical in terms of how the practice operates versus how it operated prior to this?
I mean, it's one of those things where if you're a dental practice and you're not doing it, you're kind of behind a lot of other, not just dental offices, but like he was saying, other companies, you know, medical offices and, you know, other types of offices. They all kind of gone this way, and so they're used to already doing that. You know, they're used to ordering all their groceries online and picking it up or having it delivered without ever going into the grocery store, or, you know, whatever the case may be. So it's the same thing with dental, even though it's serious and it's, you know, you're getting an actual service, we have to go in. If they can do as much as possible beforehand and spend as little time there as possible, that's what they're going to be used to, just like with anything else. So I think it's really
so more is more.
Do what?
More and more, just how it's going to be, because if not, you feel like a dinosaur as a practice, and your staff gets used to this. Staff doesn't want to have the time wasted by doing a lot of things that could be done easier today.
Yeah.
Thank you. Cynthia, question for you. Tell us a little bit about the resources needed for a practice to start adopting these contactless solutions. I mean, what staff, people, time, computers, what's needed to help do this and get it done efficiently?
I was just really thinking about this because I knew that this question was going to come up. I think really working with your team, having as to how you're going to do it, a system per se of how you're going to implement and adopt, and I think changing that mindset, because it's no longer about making our jobs easier. It's about keeping our patients safe. And so that changes the mindset. I mean, we're in the people business, we take care of patients. So anything we can do to keep them safe, it makes it easier to implement, from a team perspective. But I think sitting down with our teams and really going through what we're going to do, why we're going to do it, how we're going to do it, and then thinking of what are some possible things that can go wrong. What if these things go wrong? So always having a backup plan to move forward. And I say that because I've had it where we rolled it out and it didn't work. And so it was like, have to back up and start again. So getting everyone together, having a plan, knowing the what ifs and how we're going to handle them if the internet goes down or whatever, just having those plans in place. And then really being open-minded and holding everyone accountable for moving forward.
Thank you very, very much. And in a lot of it's so funny, because I think in terms of resources, computers, teams, all kinds of things, and each of Cynthia and Lai think much more in terms of like having the people on the same page, having the people engaged in this and thinking about what are we going to do is really the most important necessity for making this work versus the abstract or other things that come to my mind. So it's interesting because I think you're clearly right, and it's so interesting to hear your perspectives on it because they're so right on. Mike, and I guess I'll go to the question that is partly on some of our minds, is when you implement these types of technologies, contactless solutions, and so forth, do practices need to obtain technology above and beyond the practice management software to implement contact solutions? What do they need to do this right? What's important?
Thanks, Scott. I think, you kind of said it, that PM systems, practice management systems, they run a practice and they take documentation and they do notes and they file clinical paperwork. This type of functionality is very new, very cutting edge. And it needs to be done by niche vendors. And I say that just because the niche vendors can move very fast. Text to pay could be the cool thing today, and online chat could be the cool thing tomorrow. And vendors that specialize in those types of things can move that quickly. Legacy type systems, they don't have that ability to kind of move that nimbly and adapt to that type of technology that quickly. So definitely, I think the way to go on these is a specialized vendor that can do patient registration, that can do online payments, that can do text to pay, that can really, and also adjust it to various offices and adjust it to various functionality. Not every office is going to do every functionality. Some offices, as I said before, they may want to dip their toes in something like text to pay, or they may want to dip their toes in something like patient registration, but maybe not both at the same time. So the smaller, technology vendors or the niche vendors that specialize in this are the way to go.
It's so critical. Just again, say that again. At the end of the day, your practice management solution, your typical PM solution is not going to handle this. You need technology above and beyond it, but you need niche vendors that really know their stuff, but that are doing it enough that you're going to get great results quickly. Mike, is that a fair statement?
Definitely. That's the way you put it. In that, this is, you don't have your practice management system become your telephone vendor. You wouldn't buy a telephone from your practice management system because telephones are specialized. This type of technology is specialized and requires specialized vendors.
Thank you very, very much. And Lai and Cynthia, I'll ask you another question, and I think it's probably pretty clear, but is this something you see, these movement towards digital tools, contactless solutions, and Lai, I'll start with you. This is with us for the long term, isn't it? I mean, you couldn't ever see going backwards on this, could you? Or will there be certain things that do go backwards? Why? Can you take a lead on that question?
I definitely don't see it going backwards. You know, it's one of those things where people get used to it, used to how life is, and they're just going to expect it. You know, they have expectations now of what your office doesn't let me fill out my paperwork ahead of time. I can't pay you text to pay, or, you know, you don't have after hours where I can chat and ask questions. I mean, they're already so used to this now. I feel like just in the last few months that if all of a sudden everyone got vaccinated and the pandemic was done, it's not like, okay, well, we're not going to chat with you online anymore after hours. They already have it in their minds that this is what we offer now, and then they're going to expect more now, even on top of this. So it's definitely here to stay. There's no way it's going backwards.
And Cynthia, some of your thoughts on this, and how much will this accelerate more over the next couple of years versus where it's at today even? Cynthia, any thoughts on the utilization of digital tools and, you know, post-pandemic?
Yeah, I think that we are just tipping the iceberg on this. I do. I believe that it's here to stay. It has been so surprising to me, and that even, you know, our older patients are doing this. I mean, they're scheduling their own appointments online, and, you know, they bring their phone up to you and say, "Hey, which one of these do I push?" So I think it's here to stay, and I think it's only going to get. I think we're going to find more and more ways to utilize digital tools.
Thank you. And Mike, let me ask you this question. You've really been at the forefront of watching this evolve. Just take a moment on your predictions for the future. Are we going to get far more digital and contactless? I mean, there'll be some balance of it as people get more comfortable coming back and sitting in a waiting office and so forth. But in the long run, you've seen so much of this. Is this trend just overwhelming and pervasive in where we're going?
Yeah, absolutely, Scott. I think there's a good amount of technology right now to ingest. We talked about it earlier. You know, patient registration, online payments, text to pay, card on file. This has all been out for quite a while. I mean, the retail industry, it's been out for decades. Now it's getting into dental. So right now there's a lot to ingest, and then I think we'll ingest it and we'll utilize it to service patients, and we'll only build on it from here going farther. You know, where that, you know, every office will be doing patient registration. Every office will be doing at least online payments or card on file. And then, you know, 5-6 years from now, they'll be the next big thing. And at that time, we should have ingested everything we have now and be ready for the next big digital age at that time.
Thank you very much. Mike, Lai, and Cynthia, we're at the end of our formal comments and formal discussion. I do want to encourage our audience to, you know, to enter questions in and so forth into the question and answer box, you know, or text Scott Becker 312-399-0774. We'll make sure our panelists get the question. Mike, let me ask you this question first. Is there a specific service that people are using to make sure their protected health information stays secure, to ensure security of PHI stuff? Is that in your wheelhouse, Mike? And if not, we'll ask Lai and Cynthia some of their thoughts on that.
Well, all the solutions we've talked about today, and including Rectangle Health Solutions, they're required to maintain a lot of standards around PHI, around storing the data, around accessing the data. When patients utilize these types of solutions, they're vetted, and they're vetted to the extreme, and usually most of them will have a disclaimer about that. And at any point in time, any office can purge any PHI data. So I don't know about a specific service that would sort of highlight where all of your PHI exists, but I do know there's enough certification and enough checks and balances in place that all of this data is extremely safe and secure.
And Cynthia, let me ask you the question around that. Is there anything specific you see with PHI that you're working with, or is it really embedded in all the tools that you're using?
Yeah, it's embedded in all tools that we're using, and I don't know the specifics. I'm very lucky that that we've got a department that really takes care of all that for us. But yeah, I mean, security is our number one. Patient care and security, number one with their data.
Thank you. And why? Any of your perspective on that? Specific security tools that you're using, or is it really just part and parcel of a lot of that you're doing? Or do you have specific security solutions?
Well, we have an IT department that handles that, and I'm constantly, in contact with them because we want to make sure that everything that's brought to us, if they're online or, whatever the case may be, that it's secure and that our patients feel like it's, and they know it's secure. And so we definitely make sure that that's all there. That's so important because, once you have a data breach, the trust from your patients is gone, and that's hard to get back. So we definitely make sure that's just as important as the form being easy to do.
Thank you very much. Cynthia and Lai, from the provider side, I can't tell you how much we appreciate you joining us today. Just a pleasure hearing your thoughts. It really does feel like a tidal wave of movement in this area, and it seems like largely for the better, quite frankly. So Cynthia and Lai, thank you so much for your time today. Mike Peluso, Rectal Health, brilliant as always, really at the forefront of this and driving it forward. We appreciate your help and support so much as well, and thank you to our audience for joining us today. Thank you very much.